little bit presentable. Oh no, that's too much. All right. All right. So good evening, everybody. Thanks for being here. As you can see, Joe is not here yet. Joe is going to be a few minutes late, but since we have quorum, we are going to get started. And tonight we only have one item on the agenda. But before I mention what we have on the agenda, I'm just going to go through the normal spiel. If I can find it, here we are. So this is our June meeting, and for Housing, Health, and Human Services, and per the governor's orders, we have been doing this remotely, and it is being recorded and live streamed on YouTube. It'll be accessible after. So I'm Maria Ortiz. Joe Verstucci is not here. He'll be here in a little while. The agenda and the materials for tonight are they're always public. They can be viewed on the website. I personally encourage people all the time to join the listserv to get e-blasts with the agenda and links for documents and find out about what's happening in the community. If this is your first time, what's going to happen is the presenters here this evening are going to give a presentation. Then the committee is going to ask questions and make comments. Then members from the public, also known as attendees, are going to ask questions or make comments, and then the discussion goes back to the committee members. Sometimes we write letters of support or write a letter making recommendations, or also called a resolution. Most important, finally, just so how you can be heard if you're part of the public, if you want to comment or ask questions, make sure that you raise your hand. It'll be on your screen somewhere. I don't know if anyone's calling in, but if you are, you have to press *9 to raise your hand, and then *6 to unmute. And let's see, I don't think there's anything else that I'm missing. Tonight, we only have one agenda item, and that's NYSNA. NYSNA is New York State Nurses Association, and they're here to talk with us about Mount Sinai West, which was formerly Roosevelt, to talk about part of the psychiatric unit being closed. We have Jeremy Markman and, I forgot how to say it, Nagwit. I forgot how to pronounce it, I'm sorry, and Vontel Dozer. I'm gonna ask that you three introduce yourselves and where you work at or your affiliation, please, and correct me. Well, I'll ask Jeremy to introduce yourself first.
Yeah, hi, I'm Jeremy Markman, Director of Strategic Campaigns at the New York State Nurses Association. And I do work with my turf, so to speak, as a political and community organizer, because I work in that department, is to work with all of Sinai and all the facilities that go from Harlem down below in Manhattan. So I'm very happy to be here. Sinai's awesome, awesome team, awesome nurses.
And Anne?
Hi, good evening, everyone. Thank you for having us tonight. I apologize if there's going to be some background noise. I am in the hospital in a safe space. I don't know if I do want to introduce though our RN who will be also speaking tonight, Vontel. I just want to make sure that she's already on the participants list and able to unmute herself.
Done.
And I guess, Jeremy, we can go ahead with the PowerPoint. Is that
sorry,
okay, Maria?
Anne, did you already say where your affiliation or where you work? I'm sorry, I missed that if you did.
Yes. So my name is Anne Beryl Naguit. I am a registered nurse. I work for NYSNA as a lead program representative, and I represent the all of the sites that are under New York State Nurses Association in the Sinai system, including TCC and New Jewish Home as well. So I'll be here to, advocate for our psych patients in, particularly at Mount Sinai West, and our nurses who are caring for those patients tonight.
Thank you. And Vontel, can you just introduce yourself as well, please?
Hi, yes, thank you for having me. My name is Vontel Dozier, and I'm a registered nurse at Mount Sinai West. I work on the addiction inpatient detox and rehab unit. It's part of the behavioral psychiatric department at Mount Sinai West. And I've been at the hospital for 35 years. I've been in the addiction unit for 15 years.
Great, thank you. And Jesse has the PowerPoint and is ready to get it started.
Let's start the PowerPoint.
You do have the PowerPoint, right?
Yeah, I got it. I'm just confirming that you guys want me to start it.
Oh, yes.
Who was leading the meeting?
So Anne is gonna do the PowerPoint, and then we're gonna go into Vontel. I'm just kind of here for support and some of the backup and the asks at the end. So Anne, you can take it away and just, I guess, tell him Jesse's slide, or next rather.
Yes. Thank you, Jeremy. Appreciate that. And again, welcome and good evening to everyone. My name is Ann Naguit. So, we're going to zero into the particular reason why we asked to be heard today in your community board. And it's really for the Mount Sinai West facility and a particular unit. It's called 9G, but it's really the medical detox unit at Mount Sinai West. Next slide, please, sir. Okay, so prior to the pandemic, 9G is a 34-bed unit and was almost at capacity. And December 2020, the hospital basically decided to close 9G. And their reasoning is that, okay, we're preparing for a second wave of COVID during the fall and winter. So 20 of those 9G registered nurses were actually redeployed to assist on other floors. And to also assist in other adult site units, in particular, that's 7G. And NISNA, right now, NISNA is the union that represents the nurses at Mount Sinai West. So we represent them. They have a collective bargaining agreement. And despite these conversation with management, we've advocated and we really never believed that the closure of 9G was necessary. However, management has continued to say that it will reopen and that we shouldn't be worried. And just last Wednesday, they did verbalize in one of our labor management meeting that they plan to reopen this unit again in July of this year. But that's not yet, absolute and certain. Next slide, sir. So 9G nurses are psych nurses, and they are dedicated to this profession and care deeply about their patients and the care that they're getting. And the barriers of care is basically the hospital, right? They claim that 9G patients are being served at Beth Israel. That's a Mount Sinai facility downtown. The big issue with this is that some of our patients will not get the care there once they're turned away at West. And others will try to get a bed but will not be able to because Beth Israel's unit is often full and cannot accept patients from West. And onto the last, we can go to the last PowerPoint page. But before we go to the key takeaways, I do want to pivot and have one of our rank and file nurse who's been there for many, many, many years, strong advocate of our patients, Ms. Vontel, to articulate, we need to hear it directly from them, why we are very passionate about this cause. Vontel, would you like to speak?
Yes, thank you. So, as Anne said, we are a 34-bed medical detox unit, but another thing, we're also an inpatient rehabilitation unit for substance abuse. That means that many of our patients that come in for detox, they are able to stay for anywhere from a 14 to sometimes a 30-day inpatient rehabilitation to help continue facilitating their treatment. So that part of the unit has been closed also. Our patients are unfortunately part of society that get looked down on, but they still are part of our human race, and we still deserve to give them the care that they need. Many of our patients are now being treated in the medical units, uh, being treated, not really treated, but having a small amount of care being given in the emergency room and then sent out to just resume the behaviors that have brought them to this point in their life. On the medical units, they're not getting the same care because those nurses, number one, aren't really, it's not that they can't take care of them, but they have patients there that are much sicker and may need a different type of care. Our patients have sometimes personality issues that can be very difficult for an unseasoned nurse in that profession to deal with. The Beth Israel facility downtown, I don't know what their capacity is, but I can tell you that they can't be more than 35 beds, if that. Um, I've seen some of our patients on the street saying, you know, Miss Vontel, I've just been getting high until I can come in and get treatment again. I really want to come back. And the fact that I go to other units and I'll go in the room and I'll say, hi, what are you doing here? Oh, I came in for detox and this was all they had. So you know, it's really a disservice to the community, it's a disservice to the patients, and it's a disservice to society that, you know, we're supposed to be in the profession of giving care to everyone, and that includes the downtrodden, the ones that aren't downtrodden. Our unit has taken care of, over the 15 years that I've been there, our youngest patient has been 17, our oldest patient has been 96. We've taken care of patients that come in with a Black American Express card and pay for 28 days. We've taken care of people that are in the religious facilities, religious communities rather, and we've taken care of, you know, so many people, and we just would like to get back to that, because addiction is the overall equalizer. It doesn't matter what walk of life a person is in, they have the potential to perhaps become addicted to some form of substance, be it alcohol, benzodiazepines like Ativan and things like that, or rather they're addicted to opiates, or if they're addicted to heroin, or if they're addicted to some of their other drugs that are out there, you know. So we see, when we look on the news, we see different types of things happening in our city that there are directly related to the fact that these patients are perhaps not able to seek the care that they need because there's not enough bed availability for them in the hospitals. I'm also aware of the fact that the detox units in other city hospitals have closed completely also. So like I said, this is a big part of society that we are just letting fall to the cracks. And what's going to happen is we're all going to be affected by that. Thank you.
Yeah, thank you very much, Vontel. You know, and I think for us, you know, to close out, it's very important to understand that our goal is that we need more services for the patient, for substance abuse, not less than that. And, you know, Mount Sinai Hospital, just folks understand where we're coming from, is that they do have this track record and history of closing units and never opening it again, and in particular, targeting the psych population. Back in 2018 at Mount Sinai Morningside, they used to call it Mount Sinai St. Luke's. They closed what is called the Clark 9. That's a geriatric psych unit. That's a 36-bed unit. They said they're going to do this for construction. And it is now 2021 and it is still not open. And they still claim that it will be reopened, and still it has not opened. And the you know, the construction hasn't even completely been finished. So at this point, there's only one 35-bed adult psych unit and a 4-bed psych emergency room left at West to meet the needs of psych patient. And also the detox addictions unit has been closed for over 6 months, and they have not given us any concrete timeline of when we're reopening. So what we are doing as an organization is to really, you know, seek your assistance and your help, and you know, this is really for the community, and and again, our service is to the patients and to the community, and we really seek your service so that we can continue to do what we do best, which is caring for our patients. So, and then we'll open it up for the floor. Does Jeremy and Vontel want to add anything?
No, I've said what
oh, okay.
Go ahead.
So, thank you so much, Montel and Ann. I just wanted to add in that, Ann, they recently said that they are going to they're going to open up in July, but we don't know if we can.
Yeah, there's no guarantee. Mm-hmm.
We really have a trustworthy employer in that way. So I just wanted to add that.
Thank you for the presentation. I'm just going to ask just a few questions and then I'll open it up to the rest of the committee. But my questions are really for Vontel. At least the first question is just for clarification, just so that everyone is clear and understands. So at West, there are 74 psych beds, right, Vontel?
In the division of behavioral psych, yes, it would be 74 because that would be 7G and 9G, my unit.
And behavioral psych beds, there's 74. There's 35 medical detox, right? It's medical detox, 35 beds in psych, and then 4 beds in the psych ER.
Correct.
Right? And do you know, does anyone, maybe, I don't know if Ann knows or Jeremy, but how many beds are at Beth Israel in the behavioral psych unit?
Actually, no, we don't, but we can find out.
Yes, I would appreciate that if you could.
Yeah, back in 2017, there has been, or I believe it was 2016, there were some cut downs in the beds at Beth Israel that caused some movement of Beth Israel nurses to the other Sinai system. So I do not know what their current bed capacity has been particular to psych patients at Beth Israel at this time.
The other question that I have is, also, I don't know if it was mentioned earlier, is that, I think it's important for the committee and the public to know, is that West also said that they would be opening it up. The reason you don't believe them that they'll open it up in July, you're not sure, is because they already said they would open up at a different time, and they have not. And I'm not sure if it happened more than once that occurred.
So this is the first time where we've heard last Wednesday in the morning that they have plans to reopen on July 1st. And, we strongly believe it's because of also the actions that we're taking that they're finally realizing.
Oh, so this is the first time for this site. Okay.
For this site.
As per Caitlin and Vontel, you did talk to management, and they kept on saying, "Oh, we're going to open," but they never
with no date.
And
Yes, I can add to that. We were told that the goal was to get the number of COVID patients in the hospital down to less than 15, and that would be their target to start reopening the unit. Right now, we barely have any COVID patients in the hospital. We see what the numbers are citywide, thank goodness, to everybody's due diligence. And so it's just interesting that it hasn't been done as of yet. I just also like to add that being that we are a facility that is on site in the hospital, we can take care of patients that are addicted to substances that need dialysis. We've had patients that have been pregnant there. We've had patients that have heart conditions. So it's a very unique unit because it's in a hospital and they can get additional care while they're there.
And Vontel, I have another question for you. Well, actually, I'm going to let committee ask questions first, and then we'll see if my questions aren't answered, then I'll jump in again. Does anybody have any questions? Oh, I see 2 hands. Leslie?
Yes, thank you. Thank you for the presentation. My question is, of the 75 beds, I believe it was 75 or maybe a little bit above that, do we know where those people usually, how they come to you, where they come from? Are they exactly located in Hell's Kitchen, Chelsea, or are they distributed in from other areas of the city?
So I can answer that question. They come from everywhere for the detox addiction. We have a large referral program. We have people come from Long Island, you name it. They come from all over the city, all 5 boroughs.
And none of them, I assume, come from any of the shelters or any of those other services.
Some may. Some patients we get are undomiciled, but we also help with that when they are discharged, especially if they're staying for rehab, and many times they do, we can get them into a facility that could help continue their treatment and their aftercare.
Thank you.
Mm-hmm.
Katie?
Thanks. This was such a great presentation. Thank you to all of you for sharing this information. And I assume that you're looking for sort of us to write a letter in support of this, but I wanted to just get clear on a couple of details. I know that you said that you've heard from the hospital and you're not sure how accurate it is, but you've heard that the unit will be reopened on July 1st. But have you heard any numbers? Like, could they reopen the unit, but have it only be 10 beds or something? I mean, could they shrink it, but say, hey, see, we opened the unit? Or do you think that when they do reopen, at least it would be the same number as before? That's my first question. Who might know?
Good. Thank you, Vantel. Go ahead.
I can try and answer that. I've been told that if and when we do reopen, the numbers won't be less based on the fact that some of the nurses have gone elsewhere because of the longevity of the closure, also because of the fact that, like we said, our numbers have been down for quite a while, and they feel that they've been left. Some nurses have resigned, some nurses have retired. So like Anne said, this was a unit where we had 20 nurses, and we've lost, I'm gonna say at least about 7 or 8. And so that may have some bearing on the number of patients that we can currently take, which is really unfortunate and sad also.
Yeah, but that's interesting. So you're saying that they wouldn't automatically go out and try and hire nurses for this. They're saying that we can only serve as many patients as our previous nursing staff, whoever is willing to come back. Is that it?
They may. Okay. That's an unfortunate but a very strong possibility.
Yeah. And Vantel, when you mentioned that the detox units at the city hospitals have closed as well, I remember us learning about that several months ago. And it does seem like there is such an unusual conflict, right? That so many people, want people who have addictions. They want them to sort of get off the streets and get help, but that our city is dramatically reducing the opportunities for people to get the help that they need. Because my understanding was when they closed the city hospital detox units that they were saying, oh, well, there are these other ones that are still available. But now you're saying, yeah, and ours has already at least temporarily disappeared, and we're not sure it's going to come back at full force. So I'm just wondering, do you have a sense of how do your 35 beds compare to the number of detox and addiction beds that were closed as part of the city hospital detox closures?
Well, let's see. When we talk about city hospitals, I'm a resident of Brooklyn, so we have Kings County. That unit closed before COVID. In Manhattan, we have Bellevue. They closed their inpatient detox, and then I guess in Queens we have Jamaica Hospital. I think that's a city hospital. And the Bronx, is that Lincoln Hospital in the Bronx? I'm not sure. In Harlem Hospital, I believe they closed theirs also. But they just had plain detox. They didn't have detox with rehabilitation because
none of them did?
No. The thing about treatment is that treatment has to be ongoing. If you just come in for a short 4 to maybe 8 day detox, and you have nothing else, and you have to go back to the same areas. Some of these people, not all of them are homeless, some of them are employed. They have a very great support system, which is one of the things that's very instrumental in them helping to maintain sobriety, which is difficult, but they do have these things. And if they have to go back into areas where they have no support, or they're not there long enough to be away from the substance, you see the relapse that happens quite often. And it is a field, it is an area where relapse is common. But I have seen in my 15 years, I have seen very good success stories. I really have. People do get clean and they do get healthy.
That's great. But that's a good point. You're right. We should push for your rehab part, obviously, is important too. Great. Thank you.
Thank you.
Thank you. Next, I'm going to call on Dolores. I believe you had your hand up, Dolores. Maybe.
Maria, can I just,
You can jump in. Yes, Jeremy.
So I just also wanted to point out that this is a trend that is happening all across the state and probably, in all across the country, where they're downsizing, psych services, mental health. And it's interesting, especially like what have we been hearing, like with the mayoral race and everything like that. It's mental health. We need more mental health. But, it's not, we're not seeing that. And we're seeing actually at a time when, we need it more than ever, and it's worse than ever. They're downsizing and they're getting rid of these services. And sadly, a lot of times it's profits over patients because it's not the profitable thing. They rather do cardiology and stuff like that.
Thanks for adding that in.
With apologies,
Dolores.
Maria, I didn't realize, I still have to unmute on Zoom, whether on the phone or on video, so apologies. I'll be perfectly blunt. I immediately hear this. I have absolutely zero questions. I just have one reaction. We have to advocate for the full amount of potential services possible, because we already know many of the issues that we're seeing in our community, we've heard it for an entire year, are because we are not able to provide appropriate mental health and support services for those in crisis. So I know that other committee members are probably going to speak, but I'm already ready. We need to just vote on getting an extremely strong letter of support for not only this unit, but the unit being expanded if possible, more funding for it, as well as ensuring that there's complete cooperation with the hospital so that the full effect of the treatment can be made. Because as it was already mentioned, there are many people who might be in crisis, but also have medical issues. And if that can be helped concurrently, we know looking at a patient holistically, they have a better opportunity for a better outcome. So I'm strongly supporting that we just write a letter with the strongest language possible to support this unit, not only getting back up and running, but more funding, more support.
Thank you, Dolores. I'm going to jump over to Paul and then JD. Okay.
Sure. Yes, I am in fact unmuted. Thank you for the for the presentation. I was unaware that there had been this retrenching, and so let's start. Actually, let's start there. Whoever of our presenters would like to answer the question. You're the king of New York, and someone says, we'd like to fix this problem. We think psychiatric nurses are the answer. How many beds would you like? What's the answer to that question? Is there one? Seriously. How short are we? 35 beds. I want you to have your beds back yesterday, but how large is the problem for what everyone pays lip service to, the medical treatment of people with drug addiction of any kind? How short are we as a society, as a city, right here, right now? Any idea, a guess?
I don't have an idea, but I will add this anecdotal. Before Hurricane Sandy, Mount Sinai Morningside, which was St. Luke's at that time, had a full 35-bed just detox unit, not even rehab. And my unit, 9G, we were a 40-bed inpatient rehabilitation substance unit. When Sandy came, they closed the unit during Sandy, and they never reopened it. So they had to combine my unit, which was serving for rehab for substance abuse of up to 40 patients, and combine the detox. So that cut down the number of treatment. And this is, Sandy's been how many years now? And that wasn't
2012,
reopened? Yes.
So we're talking, well, the other, we've all, of course, been part and parcel of the what do you want to call it? Well, let's just call it the emergency evacuation of people from shelters to our neighborhood over the last year, after which they have sort of just been somewhat ignored, it would seem, by the folks who brought them to our neighborhood. Our neighborhood is notoriously welcoming to people who need that sort of help. But at the moment, I mean, we just last month, we heard some horror stories of how just dispersing them the way they were dispersed, with no arguable plan about when or how to treat them once they were here, had led to scenes of people who were homeless, had been moved to hotels, but were being preyed upon by drug dealers. And, you know, that's just the worst kind of, that's just really making a bad situation much, much worse. I wanted to ask you all, since you're in the business, what is, you know, different times there are different most popular substance abuse. Are we currently here in the city? Are we seeing opioids? Are we seeing fentanyl? Are we seeing heroin? Are we seeing all of them? Is there anything resembling a trend? I'd like to try to get the Sacklers to be blamed for as much as possible. But seriously, what are you seeing most? Does that matter?
So we're seeing a lot of opiates. Believe it or not, we see a lot of benzo also. And the benzo people are not the homeless people. They're people that have jobs that are addicted to benzodiazepine. Not so much fentanyl, because now, believe it or not, they have a kit where they can test the heroin to see if it has fentanyl in it. And then they know to take less of the drug so that they do not OD. So the ODing has gone down in terms of fentanyl being in that particular substance. But now the drug dealers are putting fentanyl in other things, in K2, and putting it in pills. And, you know, they're the worst of society, truthfully, the ones who deal drugs. So, and then, well, cocaine is not a physical addiction, it's more of a psychological. So people that had addiction to cocaine, they would come into the rehab and they would stay there for 28 days, and we would give them treatment in terms of groups, in terms of education about what the various drugs do to the body. Of course, we have the number one drug in the country, which is alcohol. And we would have the patients come in for the detox for alcohol, and we would educate them as nurses as to what that does to your body, and also other illnesses that they may have: diabetes, high cholesterol, heart disease, liver disease, HIV, AIDS, hepatitis, a myriad of things.
Thank you.
Thank you very much. Thank you.
Thank you. JD, I know you had something to say. Josephine, I'm sorry, I'm just going to jump to JD because I saw he wanted to respond to something Dolores was, I think you wanted to respond to something Dolores was saying.
Can I be heard? Can I be heard?
Yeah, I hear you better now. Yeah, go ahead.
Okay, thanks. I just want to say, first of all, my experience with hospitals and care is that nurses are the bedrock of our system. I will take any nurse over 100 doctors. You guys are heroic, and I never use that word lightly, but you really are, especially what you're doing now. I will say I will not support a letter that goes out saying, do this or do that. I think a more effective letter would be to demand from Mount Sinai West or whatever it is that they respond immediately to these very troubling things we are hearing about a lack of care for our community. I don't think we should write a letter without trying at least to get the other side. I'm not saying you all are not totally right, but if we just write a letter saying do this, it will be ignored. So what we should do, I think, is first write a letter saying, we've heard some very troubling statements. We demand to know what's going on. And I think we need to do that because I don't know the full story. I do know in our neighborhood, we have a lot of folks move from congregate shelters to hotels here. Now they're supposed to go back to their home congregate shelters, but the state has to sign off or something has to sign. It's very complicated sometimes. So I think would be better, Dolores, if we first hammered the administration to give us some answers so we can pursue these very real concerns that you have brought up. And I think we are very good at doing that because we can enlist our electeds to demand that we get some answers about this before we insist that they do something. So that would be my suggestion. And again, thank you all for your life's work that you do for everybody.
Yes, it's
and I'm going
Vont.
to do this, so Vondale, I hope you'll forgive me for that.
Thank
Yeah, Vontel and Ann are the nurses here this evening. And so I see we have Jessica's hand up and Josephine. Josephine, I'll let you go, then Jessica. And I see we have one hand up in the public. And then we'll discuss what points are going to be in the letter. Josephine, go ahead.
Hi, thank you so much for being here, and Vontel and Anna for your dedication to these patients. You know, just coming here to educate us means a lot. I just have two questions. The first is, are you subsidized by the city in any way? Do you get any money to run this psych program? Is that a way that we can help advocate to get the city to pay for some of this? And secondly, I guess for the majority of patients that you have, do they come in voluntarily or are they brought in by the police, or how do they actually get to you? Thank you.
Okay. So some of the patients come in voluntarily. Some of our patients, we actually had I guess you'd say a contract with the drug court in Brooklyn, where a lot of the patients will come. They will be mandated for treatment. There's a judge in Brooklyn that feels that, which is true, treatment is better than going to jail, you know, for a person that commits a crime as a result of wanting to get high. And so, but most of our patients, most of it is word of mouth. Sometimes they speak to each other. And then, like I said, the other part, in terms of funding, I can't say about whether the city subsidizes, because we get private insurance, we get Medicare, we get Medicaid, and Medicare is 65 and older. So when I say that, you're looking at a population of elderly people that we treat also. We've even had people that were deaf and blind in our unit, and we've taken care of them. So I don't know what kind of subsidies they may get. I know that our current president, you know, said that substance abuse is something that we need to continue treating in this country because it's not something that has gone away or may go away anytime soon.
Okay, I just have a quick follow-up on the judge you were talking about in Brooklyn with the mandates patients to get services, because there's a lot of talk about that right now. So is it just kind of, it's just left up to each judge's decision, because not everyone is mandated to get services, right?
Correct. So I would say it's each judge's decision, but they found that places where it's mandated through the court, you have a little more success because you're left with the choice of, if you don't get treatment where you can still be outside and see your family and so forth, you may have to go to jail, which whatever you did should not constitute jail. We know our jails are too full now with certain types of people right now. So the mandate, even though it's mandation, it's still voluntary. We don't tie their hands. If they like to leave, they can leave, but we do encourage them to stay. You know, why don't you sleep on it, and maybe tomorrow you'll feel better about leaving, because once again, they're coming in, they don't have access to their cell phones, and you know, they have very little freedom. It's not a locked unit. Like, you can't leave. You can leave. We don't lock you in like that, but you can't get visitors. There's a structure that we put in place to help them, because you're there to focus on what has brought you to this point. So
thank you so much.
Thank you.
Thank you. Josephine. Jessica?
Yeah, thank you. And just want to echo everyone's comments of gratitude and thanks for coming, and your commitment to these patients and to our community. And I think I really like, JD, your suggestion, in part tying together something we've heard a lot, which is or like referenced to, which is, why is this happening? Like, why is the hospital choosing this? And it's probably because of a reimbursement model or because of other things being more lucrative. And, you know, any suggestion that is, I'm not saying we should try to unearth a more attractive business model to make sure that this is services provided. I just think recognizing that this is a very complex set of decisions that lead to where we are right now. And maybe that ultimately our recommendations are things about pursuing other policies that can improve the reimbursement rate or create subsidies or something. But I don't think we know what that is yet. And so the idea of first engaging in a dialogue to really push the hospital and the city to bring more attention to this issue, it feels like is a really appropriate next step, even if that's wildly frustrating, because what we know is that we need services to these individuals, you know, yesterday. So this is a long way of, like, I started thinking about this before JD said something, but the conclusion is I would support JD's suggestion.
Thanks, Jessica. And I think we have somebody who from Albany representative, Emily's with us, so she can help us out here.
Yeah, I was just going to say, just for Joe, because Joe joined just a few minutes ago, JD's basically suggestion was that we write a letter demanding that basically West respond to this, and including obviously the electeds. JD, correct me if I did not summarize that well.
Yeah.
Okay.
I think let's get to the bottom of this and really advocate for these folks, but let's advocate knowing all the facts, because I think we can be more effective that way.
That's what I'll add. And then, so we have Emily Bartasek from Linda Rosenthal's office. You had your hand up,
yes.
Young lady.
I just raised my hand. I just wanted to comment.
You.
The assembly member, I know, has been in contact with Mount Sinai West about this unit. She just followed up again today. So we are also being told that they are planning to reopen, and we'll make sure to stay on top of that. The assembly member was formerly the chair of alcoholism and substance abuse and is now the chair of social services in the assembly. So we know how important units like this are. And so we'll continue to follow up with them. And I'll make sure that she raises the issue about the number of beds and staffing so that when it reopens, it's not at a limited capacity. And so if you're writing a letter, definitely copy our office and we'll make sure to follow up with Mount Sinai as well.
Thanks, Emily. I have a question for you, Emily. I don't know if you can answer this, but it sounds like it's a statewide issue, even though, you know, our letter is going to focus on the community, but it sounds like, which is really concerning for a lot of reasons, especially in this community, that detox units around the city, it sounds like, are being closed. And I'm just curious if your office has any idea about the numbers and why that is.
I don't know. I can definitely find out. I know in the last summer, in like the height of the pandemic, a lot of these units were closing at that point, and our office was trying to figure out why, in contact with the state agencies that oversee the programs. At that point, we were still the assembly member was still the chair of the Alcoholism and Substance Abuse Committee, and so we were trying to get information on overdose rates and the units as they were impacted by COVID. So I don't know the answer now, but we can try to find out.
And I think Emily, if you could include in that what Vontel mentioned earlier, that it's not just like the number of rehab beds, but it's also, it's not just the number of detox beds, but it's also the number of rehab beds. And I know, as Vontel mentioned, that that the city hospitals, several detox units were closed in the last 2 years. So I think it was before the pandemic. So it wasn't just related to the pandemic. They were phasing them out for whatever reason. So if you could get that in, I think that would be really helpful.
Yeah, that's my understanding. It was before COVID. And I would like to believe it's not profit over patients, but
yeah, I will definitely ask and try to find out, and we can share back as soon as we have more information.
Great, thank you, Emily. So at this point, we can decide, talk about what's going to be in the letter. I also.
So Maria, this
Go ahead, Dolores.
just because I had initially made, not, it wasn't really a formal motion, but the spirit was a motion. As usual, JD's the calm version, so I agree with his very sensible approach. However, I do ask, and again, deferring also to the majority of the community's thoughts, is we do know this unit was intact prior to the pandemic, and we do know that it has a long history in the community and being effective over the years. I do think mentioning that we at least would like to know that the hospital is committed to reinstating the unit. I think that is important because it's not as if we're asking for something new. We're asking for something that has already been here but had been reduced for various reasons. So just thoughts on that?
I guess my approach was first to engage rather than make demands. Something like that. No?
Katie?
I actually think that we can do a beautiful blend here, JD, between your suggestion and Dolores's. But I think it can be a letter that says, you know, as a community board, we're very aware of all of, you know, the numbers of people who need detox and rehab. We understand that their hospital has been, you know, has had this 35-bed unit, that it has been closed for 6 months, that it may be reopening in July. And we'd really like to understand how the hospital, you know, we're wondering how the hospital is going to be addressing these needs going forward and how many beds will be available and will rehab. And we're trying to, you know, if we can ask questions, but in a way that is leading towards, we're very much hoping that they're going to continue to meet this need kind of way. You know what I mean? So you're asking questions, but also saying that you're hoping that this need will be met by the hospital. And but if we
I'm fine with that. I accept that, but I'd also like to insist, insist, or make a very strong statement that they come set up a meeting with Jesse to appear before this committee to address some of these concerns.
What about we request that they come in July?
Yeah.
Can I just add another level of complexity to this? That just don't forget that we don't have a full board at the beginning of July. So this will need to be, if we want this letter to have.
Speak up a little bit, Jesse, hard to hear you.
Sorry, if we do not have a full board until July 28th. So if we would like this letter to have value, I think, as much value as possible, I think we need to get it out through an exec. And so that's going to be the 28th of this month. So I just want to make sure, so whoever is drafting it, we should have it run through exec so it can be ratified through exec. We send it out as soon as possible. We can certainly start making the demand of Mount Sinai West to come in July, but in terms of just getting the letter out, I don't think we want to wait till a full board, a regular scheduled full board.
Yeah.
So you need the draft by the 28th?
June 28th.
June.
Yeah, June 28th.
Well, yes, yeah, I would want it beforehand so the committee, read it.
All right, then I'll be working on that with someone. I don't know. Are there any other hands up right now? Let's see. No, there aren't. I guess I would just add the thing that's on my mind is that, and I said this, I met with Jeremy a couple of weeks ago, and something that is on my mind when I think about the closure of this unit, and I would like to incorporate it in the letter, is when we talk about the, you know, a year ago we had the community needs assessment completed. In March of 2020, it was before like the whole city shut down. And I think it's worth taking a look at. There is a section, one of the groups that's mentioned is those that are homeless and have mental health issues. And it's an interesting section. Keep in mind that it was done before COVID. So one of the things it mentions is having more beds in the community, which I don't think we need, homeless shelter beds, that is. But I think that it does mention issues with mental health issues in the community, as well as substance abuse issues in the community. And something that stands out to me is that although residents in Chelsea and Hell's Kitchen report like good rates of, I forgot how it was framed, not life satisfaction, but I would say mentally well. It's actually in New York, in this community, we actually have higher than average city rates of suicide, which are often going to be related to mental health issues and substance abuse issues, which is something concerning. And thinking about the issues that we've had in the community recently related to mental health and substance abuse, that's on my mind. And the fact that there was a member, a lifelong resident who was assaulted on 59th and 9th. And the person who assaulted her said to her, you know, I told the hospital I was going to do something. I told the police I was going to do something. He had just gotten out of the hospital, and I believe he had just gotten out of got just released from Mount Sinai West. And I think that this is just really important issue, and I'm glad that NISNA is here and that we're going to be writing a letter.
Maria, if I could, I think that's an excellent book to add to the letter about our community, specific community concern, and why we need some answers about why this unit is not yet opening.
Okay, yes, it will be in the letter. Anything
Maria,
else?
Could you just summarize the bullet points of the letter so everyone can hear it?
Well, yes, I know I should have done that. I didn't really want to, but I will. Because some of them, I'm not sure if I actually, this is what I have written, points for the letter. Some of it you can let me know what I'll take out. That Mount Sinai West has lost some nursing staff, about 7 or 8 nursing staff. I wrote that we're in a crisis, a national crisis related to substance abuse, I should say. There's what did I mean by this? I wrote profit over patients. I wrote JD's demanding a letter asking for them to come to committee, a lack of care for our community members, requesting information, basically getting the facts, requesting them coming in July. I'm going to note the community needs assessment, issues in the community related to mental health and substance abuse issues, and the lifelong resident who was assaulted. Is there anything else you think I need that should be in the letter or excluded?
Confirming that the unit will be reopened.
Will be reopened. My understanding is July 1st. So I'll
just confirming that it will be reopened. They can respond when.
Okay.
And specifically, how many beds, and will it include rehab?
So it's a partial request, partial demand, partial inquiry letter, right?
Mm-hmm. Mm-hmm.
And Maria will make that nice and pretty. So she's been working this. Is there a second on the motion for that letter?
Second.
Second, a lot of seconds. All those in favor, please raise your hand.
Aye on the phone.
Got it?
I would just thank you to the nurses outfit that came for the patient. We were very grateful.
Just want to complete the vote for a second. Anyone opposed? Anyone abstaining? Anyone present and eligible? There being none, it's unanimous. And JD, thank you for thanking everybody for coming for this.
Maria, I'm happy to help you with the letter.
Yes, thank you, Katie. I was going to volunteer you anyway. Yeah, thank you, Jeremy, Ann, and Vontel for being here this evening.
Thank you.
Yeah, and Maria, you know, my line is always open and I can get you whatever information you need. I wrote down the outstanding questions. We have an amazing research department, so I can get more technical stuff.
Great. Thank you. I have your number. I'll text you or email you if anything with the letter. Okay. Thank you for being here. And next is new and old business. Joe, I will let you take that away.
Okie doke. So we have a series of conflicting reports on the temporary homeless shelter issue. There have been 3 reports in the papers. First the New York Post, then the New York Times, and the New York Daily News. I'll give you this in sequence. And I was contacted by Corey Johnson yesterday evening about this action. Over the last 24 hours, we have now learned that the city has received approval from the state, from the Office of Temporary Disability Assistance, to actually begin to return people to congregate shelters. And the condition that finally came out just this afternoon from the Daily News is that with the provision that people going back to congregate shelters would have to wear masks in the congregate shelters. So, and they made it very specific that not just the governor, but OTDA approved this change. So that is where we are. Now, I will tell you in my discussions over the past 24 hours, it is extremely clear to me that DHS is not really fully prepared to manage this. Maria asked me a great question. She said, they've had over 14 months to figure out a plan. It sounds like it's going to be a hot mess. How could that be? And the answer is, there is no plan. It is a very disturbing thing. Maria met yesterday in the normal monthly CAB meeting regarding all the shelters and was told that they had no plans to move anybody back. There was no plan yet. So that's a pretty frustrating thing for us to be involved in constantly in this process, because there's people's lives involved, there's logistics, there's everything, happening here. So the other information that I've received is that the vaccination status of any individual is not going to be a determining factor. Because if people decline vaccination, they're going to work with it and deal with the social distancing and the masks. There's a lot of buzz on the street about that. We confirmed that people got letters again today, certain shelters, that they would be being, returned back to the congregate shelters. It was remarkable to hear the mayor saying what we've been saying for months and months and months, that people are not getting the proper social services in these hotel settings, and it's not helping the neighborhoods, nor is helping the clients. And the last piece is that there still will be, of course, any accommodation for people who have any sort of physical issues or health issues to go to an alternate location, but they will not be staying in these current hotels that are being used. I don't expect this process to go off smoothly. We've heard today from one shelter operator on West 36th Street that they expect to be moving June 29th. I mean, that's a short time away, and I don't think this is any preparation or anything for this. So as the process started with a lack of planning, engagement, thinking, logistics, I think that's how it's going to end. And that's all we know today. But of course, everything may change tomorrow. And as a companion to this, of course, we have the ongoing public safety issues that are now developed regarding the combination of the street homeless, the shelter residents, and the drug dealing groups that have, arrived in this process. There is, for everyone's information, a specific major drug undercover effort along 8th Avenue from 34th to 44th Streets, because there is very heavy drug activity, selling, and now gang activity that sort of filtered into that. There is a great effort by various parts of the NYPD to focus on very difficult problem areas, specifically Penn Station, Times Square, and that is causing displacement of people moving around. And the other issue that we've been talking about in our committee certainly is the ongoing intravenous drug use in the street. So that has become now a major focus for people to engage with on this.
And so yet we close medical detox beds in the community.
Go ahead, Maria, what?
I was just saying, but we close medical detox beds in the community.
Right. I mean, I will tell you that in this past week, my staff has removed at least 12 syringes from various planters or tree beds. We now have people wearing special gloves not to get pricked with syringes. And one of our on-staff gardeners actually dealt with a man leaning against a planter on 41st Street, shooting up in the middle of the day. So we have a huge community issue here we have to deal with. And this is not going to go away just because there's relocation of the temporary homeless shelter beds. There's now an ingrown problem that's developed here. So I bring that for people to the floor for discussion and comment. Anyone?
Can I just say
yes, Paul. Sorry, Jesse, then Paul.
Yeah, I'm sorry, Paul. I just jump in there. The syringe issue is a significant one. It's obviously a huge public safety issue. I mean, it goes way beyond just seeing the syringes on the street. But for that particular concern, I will tell you we have a very good relationship with Department of Sanitation environmental cleanup units. So we've dealt with this routinely over the last month with that. So if you are seeing them, please call them in, contact me. We'll get it picked up and cleaned up. It's certainly not going to solve the source of the problem, which we all know is the use of the drugs and the selling of the drugs and the what causes people to do drugs. But at least in terms of just walking down the street and not feeling safe and concerned about children and animals and all of that kind of thing.
Right. The Hudson Yards Hell's Kitchen bid has actually purchased sharps containers and a contract to remove sharps because their gardeners have these heavy gloves they're using now because they're finding syringes all over the place. Paul Ames.
Yeah, Joe. In the conversation, you've been involved in more than we have. Last month we heard that among the homeless, quite understandably, the word was going around. Well, why would I want to go get vaccinated? If I get vaccinated, they'll put me back in the shelter. Here I have a room of my own, et cetera, et cetera. In the interest of helping DHS figure out a plan, if they are planless at the moment, is there anything other that can be done but to segregate those who are vaccinated from those who are not vaccinated at the shelter?
That is the one piece of information that has been percolating around, that there may be sections of shelter for vaccinated versus non-vaccinated. But one of the things that our board complained about, and has not changed, is that DHS was only going once a month to the temporary shelters to provide vaccinations. And we requested that be turned into once a week and to engage with people to bring people along in a process. I mean, this is just bad management compounded by bad management. I don't think.
I'm sorry, no, such a plan, I'm sure, would help the folks who are in fact homeless and in these congregate settings act in what is in their long-term best interest for their physical health. And if the Barclays Center and Yankee Stadium can segregate thousands of people into vaccinated and unvaccinated, I think the shelters can too, and it would be a win-win. Anyway.
I just want to note those are run by private companies that have an incentive to manage as opposed to this process.
Yeah.
Other questions on this matter?
Betty? Oh, okay, she got it.
I'm unmuted. Anyway, thank you, Joe and Maria, for the somewhat depressing news. I have there's a number of questions I have, at least if they're at least putting their toe in the water to move people back to congregate living. I thought the idea of all people wearing masks seems ridiculous because they're not going to do that. That's my opinion, so that seems unrealistic. Maybe if they have one building for people that are vaccinated and one building for people who are not, maybe that would be the solution. But do they have any framework on, are people being moved back to where they used to live? Are people moving back to the neighborhood that they used to live in? That's, I would,
all of the congregate shelters are in various neighborhoods, and they're purpose-built shelters or purpose-renovated buildings that are set up for congregate shelter. So the operators own or lease or operate those buildings. That's where people are going back to. So if there's a group of people that came from Rockaway, a certain Rockaway men's shelter for mentally ill chemical abusers, they are going to that specific shelter set up for that.
So they go back to kind of their original place.
Right. It doesn't mean that the population is exactly the same, because there's a churning and people get placed and people are.
But that's the concept.
Right.
And then my other question was, let's say if we live so long that these hotels that were shelters are no longer temporary shelters. What happens to those buildings?
Those hotels are privately owned and operated and managed by independent operators who have a flag association for the hotel brand. And remember, one of them has closed already when the transfer happened from West 36th to West 40th Street. That hotel has been undergoing renovation. There was $1.3 million worth of damage to the plumbing in that particular hotel. So I'm assuming there's going to be, depending upon the use and the various clients and how people were, what capacity people had to manage on their own. There's going to be some different period, for turnover. But these are privately owned hotels. They are merely losing their contract with the city at a very high room rate that they've been using to pay their mortgages. They are hotels.
So is the concept that they will either become a hotel, or that they will be one of these buildings that become converted into some kind of housing facility?
So let's step back for a moment and talk about the Honda bill, Housing Our Neighbors with Dignity, from the state. I would note for everybody, the bill was passed, the rules was put in the budget, the bill was passed last week. There is only $100 million statewide for this. So it is not like there's unlimited source of funds. There is no geographic limitation, but there is clearly numbers of people who want to do hotel conversions, which we think makes sense in general. However, our community board has gone through a process to give specific guidelines. Is Emily still here? Yeah, Emily's still here, right?
Yeah.
Yeah. So that bill was passed, and it is not expected that a lot of these particular hotels will be the location for conversion because the high value does not permit the acquisition. That acquisition of hotels is going to be in lower value locations or truly troubled or distressed properties. And I will tell you the oddest thing I saw in the last 2 days, people with suitcases for the first time walking up 9th Avenue, going to the blocks between 8th and 9th. I haven't seen that since, March of 2020. So
they're tourists. They're tourists.
Yes, tourists, Midwestern families dragging suitcases. Like, where are we? The city that we used to know.
So I think what you're trying to say, or might be indicating, that Hell's Kitchen and Chelsea would not be locations where hotels would be converted to some kind of residential use, because
I think the only possibility,
we're not really down and out neighborhoods.
I think the only possibility, it's not about neighborhoods, it's about buildings. The only possibility where there are smaller hotels, maybe 50 or 60 rooms, the type that are the 25 feet wide, skinny, narrow things that dotted around, those are possible candidates for conversion to housing. But the large 150 room, 200 room hotels, they have way too much value, and they haven't lost that much value yet.
Okay, thank you.
Joe?
Yes.
I have a question.
JD, stop skipping the line.
Oh, I'm sorry.
Who's next, Maria?
It was Katie, then JD, and then Hector.
Hey there, thanks. A couple quick things. One thing, I know obviously there are some providers who I'm sure haven't been making plans, but I can very confidently say that there are others who absolutely have been making plans. And
that's right.
Given the fact that I am on the board of one, and I know that actually one of ours will be moving back to congregate settings next week.
See, that's because there's a provider who's been thinking about it, engaging with it,
And so the reassuring thing is, even though we get discouraged by hearing about providers who haven't been doing planning, we should also recognize that there are providers who have been doing planning. And so yay for that. So anyway, but here's my question. On our Social and Racial Justice Task Force meeting on Tuesday, one of the issues that came up, or a suggestion that was made by one of our members, was to see if we could explore and encourage more foot patrols by the NYPD in our community, because all the research shows that helps build trust and everything else, instead of it all being car patrol. And so, especially with what you were talking about, Joe, with we've seen during the pandemic that there has definitely been increased visible drug use in our community. I'm just wondering if this might be something that sort of the task force and this committee might be interested in sort of pursuing together, is the idea of talking with the NYPD and encouraging more foot patrols. And we can specifically address, these are issues that can't just be addressed by drive-by. right? Police car.
That request was already made in a meeting with Deputy Inspector Hellman in the new Business Recovery Unit. There was a meeting that the community board was drawn into, and specifically talked about the 848 program, which is, specific shifts doing locations. We made that request, I think, Maria, 3 weeks ago, right? Or is it something like that?
Okay, so you would support this if we also explore it on a sort of broader.
Right. So what I should do, Katie, I've got to sort of return and remember we made a request for a certain location in a certain precinct. I have to go back. Jesse, you there?
Yeah, are you talking about the meeting that Manhattan Borough President's Office organized?
Yeah, when we had the community board and the HKNC, everybody together. So, sure. He responded to that issue of the 848 patrols, right? And then it came up again in that walk that I had with Corey. So we got to do, Katie, we got to find out exactly, got to get the nomenclature right, because there's a specific thing about how these patrols are done and what geographic areas we requested already from the board, and then how they've responded. Like I got to catch up the info,
Yeah, but then if we can also sort of expand the request and not just
it's sort of figuring out yeah.
But if you could get that,
build upon the request.
Exactly. Right. That would be awesome. Thank you.
Who's next, Maria?
JD.
Yeah.
I'm letting you skip. I think, go ahead, JD.
We used to have foot patrols. And then the NYPD decided to use the vehicles because it could respond faster, they said. Crime decreased in the city, in all cities. So they thought it was working. Many people have said, let's bring back foot patrols. I think most people would support it in the community, at least I think in Hell's Kitchen community would be happy about that. Problem is the numbers are reduced in NYPD. I don't know, it's a complicated thing, but certainly we can advocate for it because I think the community would support that. My other question was, I don't know if this makes any sense, but before we forget the failure of the political class on the West Side, the failure of DHS, as Stephen Banks admitted to Joe, this was a mistake. And given the apprehension, the fear, and the assaults on many people in the Hell's Kitchen neighborhood, would it be advisable for us, the committee, to write a summary of what we went through, a brief summary, not a big deal, to send to our electeds or to have handy for the next time that the city receives something like this? Because my fear is the same thing will happen. But perhaps if we have something on record to say, don't do it this way, it doesn't help the community, it doesn't help the folks who need help. And if it's going to be done again, make sure that good providers are selected, like Katie's providers, and that people receive the care and that the density does not happen. Would that be worthwhile?
I would suggest we do something like this, talk about it at our July meeting, because I want to see what happens in the next 2 or 3 weeks. Because I'm concerned about possible chaotic exit also, right, Katie? That's the thing that's getting me concerned.
Well, and I think to that point, obviously no one is forced to go anywhere. And there has been some discussion about the fact, some people, especially because it's good weather right now, some people may decide, I'm not going back into congregate setting. If I can't stay in the hotel, then I'm going to go. And I really like the neighborhood, or I like whatever. I
like the availability of drugs, as the dealers have come over here. That's a crazy thing.
So we may, So I mean, you're right. It's hard to know how it's all going to play out. Yeah.
But I'm going to suggest, JD, that we definitely defer that to our July meeting and then really hone in on it, because we're going to get a much better idea of what this means. I mean, Katie, the fact that yesterday in Maria's meeting, they reported they had no direction about this, and you are already making plans and you have a date. And then we know for a fact that tenants, individuals got letters yesterday about relocation in one of the hotels on 36th Street. It's just shocking to me, I don't know why I'm still shocked, but.
This is a good opportunity for me. Hector, right before, I know you have your hand up, but before you speak, and I see we have one member from the public, it looks like Brian Weber. Let me just say about the meeting yesterday with DHS, even though I had some reception issues, I was there for most of it and could hear most of it. It was really, I felt frustrated because I felt as though I was hearing the same thing that I always hear, and especially after last month when we had a DHS meeting with Leilani Irvin and Yvonne, and they even come to a committee meeting. You know, they're reaching out to us, they're speaking to us, answering our questions, but there seems to be this breakdown between like who's at the top and Leilani and Yvonne telling us information, saying they don't know certain things, when in fact other people are finding out other things, and we're going to this meeting every month. And I will just mention that at the meeting that came up yesterday, the highlights that I forgot to mention to you, Joe, were I'm looking at my notes. Some of the more positive things, I guess, were that like NICA they are looking to increase the number of guards they have outside. They already have one that stands outside out front because everybody recognizes the fact that the weather's warmer and people are going to want to hang out more. They're also going to post a guard that's going to be by 9th Avenue. Acacia has program directors now and security supervisors in the evenings. They did not have that before. And when it comes to vaccinations and testing, it's still once a month, but they have increased the incentive I laugh because to me, this is not increasing anything, a $5 meal card, but the other ones are better, a $30 Target card and a 7-day unlimited Metro card. And Emily Bartasak was there. Emily, you were there and had asked a question about vaccinations and like, what's the barrier? And I thought that was a good question. And obviously there's hesitancy when you talk about communities of color. I think, somebody responded, one of the providers responded that, it's not a lack of education, or I forgot what else she said, but my thought is still, if the number of testing and vaccinations on site could be more frequent, that would help, right? I mean, Joe, at his sites, they've done it more often, and yes, the numbers can be low, but when
if you get 1 or 2 a week or 3, you're doing better every week.
Yeah.
It's so frustrating.
And I did share.
And I'm making more progress. It's just
progress is slow, but progress happens. And I did share, that one of the providers, Acacia, actually, one of the program directors did tell me, if we could have vaccinations on site more often, weekly, that would be great. So I don't know, just the challenge of dealing with, DHS and how they function. Hector?
Yes, I just wanted to comment on the ongoing homeless struggle and the issues we're having on the streets here. As you all, I'm a resident of housing, LHLC Fulton Houses, and this has been an ongoing struggle for us for many years. So this is not news to us. I'm saddened to see that it's spread out throughout the city because of the COVID situation, and even prior to that, with the failure of DHS and their programs. But honestly, it's an everyday occurrence living in housing where we have homeless living on our roofs, breaking into our doorways. I mean, I don't know how often this happens to other residents in other communities, but this is an everyday occurrence for us here. So I hope at the end of the day, we can, when things get better, hopefully we can direct attention more toward housing a little bit once things get a little bit normalized, because it is an ongoing situation that we've been living with for years here. So this is not unusual for us to find hypodermic needles and drug use rampant, and homeless sleeping in our hallways and defecating and urinating. So, my heart goes up to the people that are, feeling this for the first time or experiencing these horrors. But this is an everyday occurrance for people who live in NYCHA developments, unfortunately. And, we are taking steps to try to improve things here, but it's an upward struggle when we don't have enough police staff or presence. I'm all for bringing back the beat cops. The NCO program that they have is decent, but I feel, and many people feel here, that they're understaffed. There's not enough cops to do these beats. They are staying in their vehicles. They're not doing the walk-ups. Honestly, if you had people coming and going as they please in your hallways and in your buildings where you live, I think you'd be a little unnerved and you'd be annoyed that if the cops were not doing, not to denigrate them. I know they're understaffed at this point, and there's a lot of issues going on that they're dealing with, but it's a bit aggravating, to say the least, to live this kind of lifestyle for us and our families and our communities here. So I really hope after all this, we take a lesson for all this and look more directly at hotspots like the NYCHA developments.
So I will just note that we're not just talking about syringes or drug use in the street. In 2 weeks, I've had 2 employees assaulted walking to and from my office. One, a young man, the other one, a young woman. And it is very hard to try to say to somebody, one was working for my office for 2 weeks, and he was assaulted the second week of working there while getting a receipt from a hardware store. He was pushed and then slapped in the face by 2 guys who were very mentally ill. So this kind of, and a young woman, her breast was grabbed, so like this ongoing thing is really wearing on our sort of community psyche. So I'm hoping we're all working together to get to some different point. Now, who's our next speaker or person to speak, Maria?
Brian Weber, I saw his hand up.
Did you bring him over?
It's Brian Weber.
Jesse?
Brian W.
Just got to bring him over. There we go.
Hello?
Yes, Brian.
Okay, I have a bad connection, so I'm going to stay off camera. I just wanted to comment on the increased foot patrols that Katie was discussing. Along 8th Avenue, there is now a command post at 38th and 8th Avenue that has 25 officers from Midtown South working out of it, and they are on the street between on 8th Avenue between Penn and Port Authority because of the surge in criminal activity there. And I have had comments from a number of residents and a number of businesses that though the crime is still there, that there's an improved feeling of public safety. So to get a letter from the community board supporting this increased foot patrol presence would definitely be a positive thing. I know it's something that I've been asking for in any sort of avenue that I can, and it is good to hear from a different element of the community board that this is something that's wanted. And also, just to Joe's point, we're still in the thick of it. The transition from vacating the hotels back to congregate setting will be chaotic. There will likely be members that are living in the hotels that won't leave our neighborhood because of patterns that have been established here. And I think this is something that our community is going to have to continue focusing on and working on for a long time. So I just encourage everyone to go to their precinct community council meetings and tell the police what those hotspots are, because they will shift attention there. So thank you.
Anyone else, Maria, to speak?
Thank you, Brian. No one else.
Brian.
Oh, Dolores is an attendee, though.
Dolores?
Oh, no, I see her. I don't understand. But, okay.
Maria?
I hear you.
My hand wasn't raised, but I do think that what Brian Webb was saying, coming to the council meetings and also being in contact with your NCOs, meaning your neighborhood cops, that is very helpful in terms of in real time providing the data, which helps feed that loop of information to get responses.
If no one else wants to speak on this matter, Maria, any other new business?
No. But
Pete
Pete is waving and Jesse.
Yeah.
You
Recently,
got your
we've had
nose,
two
Pete.
fires within.
We
Can you
got
hear
your
me?
nose. Pull back on your camera.
Yeah, we can't see your face. Yeah, now we see you.
Now we can see it.
Recently, we've had two fires within one day. One on 50th Street and the other one on 48th Street. I am familiar with the building on 50th Street, and that's tenement.
Which building? Which address, Pete?
9th at 401 West 50th Street. I knew an individual that lived in that building. There was a lot of illegal work done in that building. Some of the apartments were converted into rooms. A lot of the plumbing and electrical work was done without permits. And so a fire took place. But lo and behold, today, I just got news this morning that there was a fire on 48th Street. Again, that's 2 blocks away. That's unusual for this community.
Which building? Which building, Pete?
I don't know because it just came out of the news and they didn't mention it. But if anybody has any information, can they please share that?
JD, you aware which building?
Yeah, I believe it's the corner building, 9th and 48th, and the report was that it was an overuse of electrical appliances on an extension cord, and fire personnel were hurt, but nobody was killed or injured. So that's the 3rd fire that we've had in the 3rd or the 4th in a couple of weeks.
Yeah.
And any news on the building
4th
itself? Is there any news on that building, on the one on 48th Street, regarding the violations, if any?
I don't know. It's a pretty good building. I am surprised. Mom's is the bar restaurant down below.
Oh, that's the one. Okay.
Yeah, the fires. I think it was DHS is responsible for all the fires.
Is it JD? Is that 48th and 9th on the north west corner?
That would be 401 West 48th as well.
Yeah, 401, right.
So they're both 401 on 9th, right off 9th
Avenue. Jesse?
Any information on that, Jesse?
Nope. I was speaking. I just wanted to remind everybody. Hector actually helped me remember, that I sent this around a couple weeks ago, or maybe last week, about the budget process, and so I know we're about to, beginning to sort of slow down as a community board because we don't meet in August. But I just want to keep everybody's mind on budget process. When we come back in September and October, that is really our crunch period to get in our new budget requests and our new statement of district needs, as Jessica knows all too well. And so I would just really urge folks who have, thoughts about what this committee should be advocating for in terms of the budget requests. They should be thinking about maybe even talking about those in July, and certainly bringing any, budget needs, particular in terms of specific thoughts from the tenant associations of the NYCHA buildings, what we should be advocating for. And so I just flag that for everybody.
Pete, the address it's 703 9th Avenue where the fire was.
Right, which affected the tenants on 401 West 48th Street,
right?
Because the entrance is on the street itself.
Yeah, the buildings are somewhat connected. It was apartment 5C.
5C, yeah.
Anything else, Jesse? Maria?
I have a question. I don't know if it's Jesse or Jessica can answer. Can you just remind me, what are the 3 top needs that we have in this community for the last cycle? It was affordable housing, and I can't remember the other 2.
Neighborhood preservation and then transportation safety.
Okay. I think we need to change.
If we have no other business, I'll entertain a motion to adjourn for this evening. Moved, second? All those in
Second.
favor, please raise your hand.
In favor.
Aye.
Thank you all very much and really appreciate, thank you, Maria, for chairing the first part of the meeting. Really appreciate it.
Thanks, y'all. Good night.
Night,
Good night, everybody.
Good night.